We cannot let any moment be without having those caregivers and nurses.
Well, the clock is ticking for staff and healthcare facilities nationwide following yesterday's COVID-19 vaccine mandate announcement. Some Hoosiers have 1 month to start their vaccine series to be fully vaccinated by January 4th. Good evening, I'm Debbie Knox. CBS 4's Bianca Reyes joins us now live in our studio. And Bianca, you spoke with local nursing homes. What did they have to say about this new federal mandate?
Well, Debbie, to recap, this mandate was issued by the Centers for Medicare and Medicaid Services, and it says all facilities who participate in either of those programs need to be vaccinated in 2 months' time or lose their job. Officials I spoke with say they're scared of what this mandate could do to an industry that's already hurting for staff.
This morning, our executive team to really sit down and figure out, okay, what are we going to do?
It's now a race against the clock for executives at Hooverwood Living. Out of the more than 225 staff on hand, 75% are fully vaccinated. But that still leaves 76 staff members at risk of being let go come January 4th.
We are obviously concerned because at the end of the day, the most important thing that we do is to take care of residents 24/7, 7 days a week.
Hooverwood Living's chief executive officer says he needs his staff, and without them, he will need to hire third-party agency staff to fill the gaps.
So that's not an ideal situation. In fact, not all, but many of those agencies are taking advantage of this situation with exorbitant rates. And also making, unfortunately, sometimes the quality of the work we get isn't great.
But it's the reality many facilities face. The Indiana Healthcare Association and Center for Assisted Living says 65% of its members statewide are fully vaccinated, with another 2.5% having gotten their first dose.
I think that we have a really tough road to travel to get to 100% or even 85%.
To attract more staff and encourage them to get vaccinated, facilities are offering bonuses and increased wages. But in the end, experts say they simply don't have the one thing that could boost vaccinations.
It's going to take time, and ultimately it's going to take a lot of one-on-one personal conversations with individuals, and frankly, time for folks to see how effective it continues to be.
Now, the Indiana Healthcare Association says some facilities may even have to turn potential residents or patients away if they don't have enough staff to take care of them. According to its latest survey, 99% of providers they asked say their staff are working overtime or double shifts. Reporting in the studio, I'm Bianca Reyes, CBS 4 News.